Do you ever wonder why you're probably taking all of your medications, but you go back and you're not better and possibly you're even worse? Here's why. Because the medications are not trying to resolve your condition and they're not addressing what caused you to need the medication in the first place. So for example, you're just told by your doctor that you have high blood pressure, but your doctor never asks the question, or you may never ask the question, why do I have high blood pressure? You just accept that you have high blood pressure and now you need to take this medication. Yes, the blood pressure medication may lower your numbers, but it's doing so as a compensation for what's not naturally happening in your body anymore. And as long as you're introducing this compensation or workaround and not addressing the root cause, that problem, the root cause, is potentially getting worse and worse. And what happens to people that are on blood pressure medication? Eventually, the medication doesn't work to control their blood pressure, and you need to add more medication or increase the dose or add a different medication. Conversely, if you were to address the root cause, which I'm telling you is sugar, and change how insulin resistant you are and become insulin sensitive again, then you potentially will reverse the hypertension as well, because you're not sending the signal to the kidneys to hold on to the salt and water, which is what causes hypertension. So you take away that signal, you no longer have the retention of the salt and water. You no longer have the elevated blood pressure. You no longer need the medication. You no longer have that as a diagnosis on your list of medical problems when you go to apply for life insurance as something that they could deny you for. I mean, I don't know about you, but that seems like a pretty big deal to me, to not have a diagnosis anymore. And people don't even know that that's an option. So that's where I come in. I look at things through a functional medicine, personalized medicine perspective. I'm not looking at you as one of the other people that are in the same box that need the same medication. I'm looking at what things that you did in your lifestyle, in your nutrition, in your sleep or lack of sleep, in your ability to manage stress or lack of that, that led to you having the elevated blood sugar, having the elevated insulin, having the increased salt and water retention. And then let's fix those things. Those don't require medications to treat. The medications to treat high blood pressure, oftentimes they lead to nutrient deficiencies, which lead to other problems. So this revolving door concept of the conventional medicine system versus a whole new approach, which is patient-centered, which is specific to you and helping you resolve your problem. That's what I want to help you do.